Coronavirus is a virus that attacks the respiratory system. This disease caused by a viral infection is called Covid-19. Coronavirus is a new type of coronavirus that is transmitted to the human. This virus can infect anyone, whether babies, children, adults, to the elderly. Now that you should know how to prevent of the coronavirus. 1. Wash your hand frequently. Wash your hand thoroughly with alcohol or soap and rinse under running water. By the way, you can use hand sanitizer, but wash your hand more effectively more than you use hand sanitizer. 2. Maintain social distancing or physical distancing. Maintain at least 1 meter between you and anyone. 3. Avoid touching your eyes, nose, or mouth. 4. Close your mouth with elbows when coughing. And last, stay at home to break the chain of spread of this virus. That's the way to prevent coronavirus or COVID-19. By the way guys, I'm not alone today. I'm with fourth speaker to discuss about coronavirus. Okay, before I meet them, I should use masks. Because masks protect you from coronavirus. Okay, my viewers, before we discuss with them, we invite them to introduce themselves. Start to Sherina.
Hello everyone, I'm Sherina Saputri. I'm a lecturer from Baturaja University.
Assalamualaikum warahmatullahi wabarakatuh. My name is Ramadha. Here I am as Head of Village Baturaja.
Assalamualaikum warahmatullahi wabarakatuh. My name is Dian Aryani. I'm here as a doctor for Baturaja Hospital.
Hello everyone, I'm Lesti Fitrianti. I am entrepreneur in Baturaja.
Okay, now I want to ask you one by one about the impact of coronavirus in your life, in your job, and in your society. Okay, I want to start to Ramadha as a government. Ramadha, what your response about the coronavirus?
There are so many, of course, the impact of COVID-19 on life in society. Some of my residents have complained about being dismissed and forced to become unemployed. There is no income, but expenses are increasing. But thanks God, there is a little help from the government so that it can ease the burden on the family. I also always my residents to keep the environment clean and use masks. Wherever we also often spray from house to house. Hogs everywhere, which disrupt the community. Whenever there are residents who return from wandering outside the area, my residents like the reports that they are afraid to carry the virus. Finally, they were quarantined independently at home for 2 weeks. In the field of education, online schooling for adult children is not too troublesome for parents. But for children who are still in kindergarten or are still in grade of elementary school, most of the parents will do their job. They are told to do the tasks. They are told by their mother. They don't want to cry, and finally, the mother does the job. My hope is that this virus will soon disappear from Indonesia, not only in Indonesia, but throughout the world, so that life can run normally as usual.
Okay, for the next, let's we listen the impact coronavirus in world of education can explain by Sherina. Okay, Sherina, fine, it's yours.
Currently, all countries in the world are facing the COVID-19 pandemic. All activities are restricted to prevent the spread of the coronavirus, including educational activity from primary and secondary level to tertiary level are conducted online without face-to-face contact between teacher and student. By using this online learning system, sometimes various problems faced by students and lecturers, such as subject matter that has not been completed by the lecturer and then the lecturer replaces it with another assignment. This is a campaign for students because the assignments given by the lecturer are more. Another problem with this online learning system is that access to information is constrained by signal, which causes slow access to get information. So students are sometimes left with information due to inductive signal. As a result, they are late in collecting an assignment given by the lecturer. There are still many positive and negative impact of online learning system, but for now that's all I can say. I think enough. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
As we know, we have to stay at home. So, that is an impact on economy. What do you think, Lesti, as an entrepreneur who is affected by COVID?
As we know that the government has implemented social and physical distancing for approximately 1 year. The implementation of social distancing limits the movement of the community. Even the lockdown results in people being unable to move outside the home. Even those who work daily or street vendors. Many parties have felt the impact of this pandemic, such as reduced community income, especially those with daily income such as laborers, traders, online motorcycle, taxis, and others. The negative impact of the spread of this virus is not only felt by the community, but the business world, both on the small, medium, and large scale. The COVID-19 pandemic has hit the Indonesian business world hard in almost all business sectors. This condition threatens to even cause some companies to go bankrupt because they are unable to meet their debt obligations. Even though there is a debt restructuring policy to tax incentives, the relaxation is temporary without stop the spread of the coronavirus. In this situation, business worth decrease, and this makes many workers lose their jobs. Many families initially depend on the company experience economic hardship.
For the last, I will ask the opinion of the doctor of Baturaja, how the impact of COVID in world health.
As we know, the development of the COVID-19 pandemic has occurred so fast. The transmission has spread to various countries in a short time. In fact, the COVID-19 pandemic has an impact on all aspects of life, both the economy and the health sector. Negative impact on medical personnel. First, the hospital is overwhelmed. The doctors and nurses in hospitals that treat COVID-19 patients have been overwhelmed to accommodate patients to that. Second, risk of contracting. Health workers are at high risk of contracting COVID-19 if they do not use APD according to the level of protection for handling COVID-19 patients. Third, afraid to go to the hospital. Non-COVID-19 patients also feel anxious and afraid. For example, patients who have congenital disease will be easily affected, thus causing not COVID-19 patients to be afraid to go to the hospital. Then there is also a positive impact, namely, first, people care more. Public awareness and discipline of the importance of maintaining cleanliness and following health protocol is increasing. Second, public awareness. The presence of COVID-19 increases public awareness of the importance of exercise, which must be followed by proper and health protocol. Third, the public is more vigilant. The rising of suspicion among the community for fear of spreading it to one another is actually good because it makes people more alert and protects themselves. Maybe that's what I can say regarding the COVID-19 pandemic in the medical world. Thank you, Elisa.
Okay, I think enough for today. Thanks for my speaker. See you next time.